one of the things around anxiety, which really starts to blow me away, is even now we see with a lot of our young NBA players, whether they're Canadians or Americans, and struggling with things like anxiety or low mood at a really young age, which seems paradoxical because when you think of someone who's been training their whole life, they finally make it to the NBA, they're making all this money. We would think that this is happiness, right? This is
I don't
this
know.
is where
You know these guys better than that. That's not what it's like.
and so, are you seeing rates of anxiety in younger populations, or
We're seeing a couple of things. I mean, you work with NBA players, and so you see the inside of it, a little behind the scenes where there are those moments. It's amazing, but there's also the pressure. There's also just the incredible toll it takes on their bodies. There's also the fact that you're a commodity and you're treated and traded as an object, which I just, no matter how much your team loves you and your fans love you, that's really hard on the psyche.
mm-hmm.
That you've got a little moment in the sun, and it is so hard on these young men and their bodies. I think we've also had just some wonderful leadership from the NBA. Certainly Kevin Love started it, but there have been a number of players who are really speaking openly about their mental health and having panic attacks and depression. So it's been really great to see that. Your question, are we seeing more? So the rate of I think it was the rate of suicide went down by 6% last year, which I think I would say it surprised everyone, but I think there was a big fear there was going to be a huge surge. I'm like one of those people that I don't kind of let my breath out in the movie when things look a little better. I know that's so not to be hysterical about it or worried. I do think that as things ease up a little bit, more of the processing of what we've been through, at least for me, what I'm seeing in my patients and myself, just stuff is bubbling to the surface because it can now in a way that it didn't. If we're going to talk about folks in their teens and 20s are much more aware about mental health, but they're also facing an environment that I'm 47. It's really, and I'm really blessed. I get to treat a lot of young men and women. And so I feel when I say I'm blessed, it's nice to hear about it and hear the way that people are changing everything from how folks think about relationships and relationship structure to sexuality to gender. So there's, I think, both, this new pressure in social media and all the bad stuff we hear about, but I think there's also an opportunity more than there ever has been to be yourself and to have that honored, whatever that means to you. I would say that because there aren't as many guardrails about identity and who we are, there is more of a propensity, I think, for people to struggle with really thinking about this in ways that I think my generation in some ways didn't struggle with as much or didn't have some of those questions. And so it's a challenging time. I think that the rates of depression and anxiety, certainly in some of the data, have gone up. And I think certainly when you look at least prior to this year, what was happening, we were seeing tremendous rises in, suicide is sort of the measure that gets talked about and used. But I think it's important also to just look at straight up rates of depression. So in the US now, and I don't think this is bad. Often the statistic gets thrown around and people are like, ooh, it's horrible. But 1 in 4 women over the age of 60 take an antidepressant medication. And it's an interesting statistic for a few reasons. One is, that often gets pronounced as well, we're overprescribing antidepressants. And I think that's one way to look at it. The other way to look at it is we culturally promote depression in women over the age of 50. And I think to me, that rings much more true. We just don't,
that environment situation,
we just have a hugely misogynistic culture and issue on our hands about that. And so certainly antidepressants aren't the way to deal with that, but when people have symptoms and symptoms of depression that stem from that, I mean, that's one of the reasons they get employed. Those are some thoughts on the prevalence and incidence of depression and anxiety and what's happening. The modern brain is up against some challenges, is I think probably what we both agree on.
Yeah. And circling back to one of your comments around identity, I think one of the things that we get if we stay on this performance side is, a younger athlete who's always been the best at their sport, and everyone tells them, you're so talented, you're so gifted, and they climb the ranks up, and which is tremendous, through high school and college, and they might finally make it to the NBA. And that's actually the first time where they're really facing a challenge where they're at the end of the bench, or they're not getting all the attention, or they might not make the team. And so that identity being so wrapped up in their being the basketball player and being the star, now that might be changed, or they might not make the team. Can you talk a little bit about how, I guess I don't know if it comes back to that fixed versus growth mindsets, but can you explore that a little bit less?
I I should tell you what it triggers in me is thinking about the challenge for all people where work becomes our identity, and particularly for men.
Mm-hmm.
You take away my patience, my practice, I don't know, what I get to do. My wife will tell you, like, come Sunday night, sometimes I'm not the best person to be with. And it's not because I dread Monday, it's because I haven't worked in the last couple of days. And then, like, I'll see some patients, I'll do some work. So they're like, how are you? I was like, I'm great. Because so much of our identity is tied up in what we do. And there's some great stuff to that. Being productive and having a professional identity. I think that's wonderful, whether it's you're a basketball player or a naturopathic doctor, or, you're speaking about as specifically as people's identity rests in being lauded. And whatever that is, whether you're the best sports, or I was talking to somebody earlier today who was like the hardest partier.
Yeah.
And as he like pulled his life into really more serious focus, there are a lot of people who are disappointed in him.
Yeah.
And so it's hard to keep perspective and have gratitude in a real way. I think it's where having people work their gratitude muscle, not in a superficial way that a lot of us do, like, I'm thankful for all this. It's like, no, like, be thankful for your big legs and your big feet and your big hands and your muscles. Like, be thankful for the fact that it's just second nature that you can drop the ball in the bucket. Be thankful that you even have a shot. I think that can help with that. I think understanding when you hit your limit, like if you're in the number 10 man on the team and your job is helping your team practice, basically. I don't know. I played JV basketball. I still to this day remember the game that I got pulled into the varsity bench and thrown in and like scored 3 buckets unexpectedly, and the look on everyone's face and the feeling of it. So I think no matter where you are on the team, you get your moment, and working on being prepared for that. At least that's my sense. You've worked with more of those folks than I do. I've certainly seen a few in my day. And I think the folks who handle that with the most poise don't see that end goal as being number one. They see and focus on the process of being in that flow state with the body, with the mind, with the gratitude. I think those are the folks who handle it the best, and often end up doing the best.
Yeah, 100%. That's definitely, our mental performance coach, Dr. Peter Jensen, always talks about that, that process and being in the moment. And I think, in past generations, maybe that building up to getting to where you needed to go, there was sort of more years built into that, and more time, I guess, to build some of those mindset skills. Whereas it feels like today that progression is pretty quick, and it's you have to be a bit more cognizant, don't they? To be able
it comes at a significant cost, that to experience adolescent development in the midst of preparing to play in the NBA. It just, it has a cost to it for these young men and women. The more that organizations that benefit from those costs, the more they can do to support mental health, services, to make sure that, we all get inspired. I love we all love to watch these players, but
100%.
I think we should all understand it. The costs, we focus so much on everything they get. And I hope that they all have access to really great mental health services as well.